Ooh, cultural sensitivity is really not talked about, but I think it's actually surprisingly important. If you're in a certain area and you predominantly are of a certain culture, you already are going to be adapted, used to it. Everybody is. And like if I were to go straight over to Istanbul and try and do a case, I would feel completely out of water. So that part makes sense. The challenge is we have such an intermingling of cultures and a sudden introduction, whether it be individuals that have been displaced due to war, like we have introduction of refugees in our particular area, and then they need access to care, and we happen to be the ones providing it. We can be suddenly introduced into a cultural base, even though we're in our own backyard. But I still think it's very, very valuable to think about the respect and value of understanding that culture enough to fulfill the treatment that we need to. I've been thrown into situations where we have to be careful about head coverings with certain patients or access to EKG sticker placements. And, I know it sounds, trite and little. I don't ever want a patient to walk out of treatment facility that I'm a part of and feel like they were disrespected. And they might not be able to necessarily communicate that in an effective way because we probably already have communication breakdown. And so I don't know how to deal with that other than upon having knowledge of the culture that that individual is based from, trying to get at least a brief understanding. So then that way I can know, okay, the things that we have to do, what can I do best? Is it a matter of I absolutely, as a male, don't enter into the room until XYZ is already performed, and make sure we always have, the family member there through all that entire, whatever the case may be. And then on top of that too, there's the post-op expectations and understanding. I like to take extra time having discussions with translators. And even what I like to do if I'm faced with a translator is, one, I'll make my statement and I don't have proof that that's exactly what was said to the patient. And so then I turn it around and then try to ask a question to the translator that they then have to ask to the patient. And so then what words I get back from the patient, from the translator, that's actually how I know that the statement that I said was actually the information that I wanted to get across. Technology is getting amazing as far as that. There's still a little bit of trust issues with the technology. I'm always afraid it's going to say something that I didn't mean to say too. Yeah, it's consideration. And I feel like us as a society, we're so much more understanding and considerate than certain have been in the past. A little pause for the cause, and we can make for a much better experience for our patients.